Okay, good afternoon. My name is Nico Snyman. I'm the CEO of Crest Advisory Africa, and I will be speaking about COVID-19 and to address No Panic Help Guide for COVID-19. What we are doing, apologies, table of contents. I'm going to address who is Crest Advisory Africa, the overview of COVID-19 by the World Health Organization, 16 proactive measures to limit the COVID-19 spread, the 3Ps strategy, helpful true information, the way forward, questions, and contact us. Who is Crest Advisory Africa? Crest Advisory Africa has been established in 2014. We are 6 years old, and in this period we have been working specifically on corporate governance, whether it is business continuity, risk management, compliance, quality management, etc. This is our forte, and we've got offices in South Africa, in Botswana, Namibia, and we are looking at hopefully this year to extend in the Americas, London, and Australia. Our 8 offerings that we have got is firstly training on various levels, advisory services or management consulting. Thirdly, audits that we are conducting first level audits, second level audits, and third level audits. Products that we have got, especially in this time of COVID-19 that we can assist you with. Technology, we've got a fantastic system that we are using that is integrated with most of the other systems that is working in a corporate governance environment. Executive incubation, we are doing events, and our flagship is international certification. So let's start with how to be prepared and not to panic. So if you're looking at firstly, this slide is actually giving you a huge concern about COVID-19, and this is actually a reality check that one needs to be looking at. Although it has started in China, you can see that the spread in Europe is extremely dense, and in Africa we have started with small pockets, and these pockets are multiplying on a daily basis. Australia is at the moment in a lockdown situation. South Africa is starting with lockdown from the 26th. The Americas has got 42,000 cases, and in total confirmed, there are 375,498 cases has been confirmed, and it is in 195 countries. So all the countries in the world has got some sort of infection. Even in this French Polynesian island that is way off the grid, it has been infected there. You can see on this graph here on the left-hand side, the growth from the 27th of January 2020, and how this is actually escalated, and this has actually surpassed all the expectations of the growth of COVID. So if you're looking at basics first, to prevent COVID-19 from spreading, the following need to be done. COVID-19 is an infectious condition, which means it can be spread directly or indirectly from one person to another. And this means that one needs to be very careful in touching things, very careful in actually touching your eyes, your nose, anything, and then touching surfaces, and as well from the surfaces back to your nose, your throat, your airways, because it is an upper respiratory tract disease that is affecting your nose, throat, airways, and lungs. And it is caused by the newly discovered coronavirus called COVID-19 that was identified in Wuhan, China in December of 2019. How deadly is COVID-19 or the coronavirus? It is highly infective. It's highly infectivity, but low mortality. Mortality rates range between 2 to 3% if it is caught early in the disease's life cycle, and it is significantly less at the moment than the SARS that was in 2003 with a 10% mortality rate, and MERS that was in 2012 with a 35% mortality rate. The risk of death is only higher in older people above an age of 60 years and people with pre-existing health conditions. So people with this profile need to make sure that they are looking after themselves, and that everybody is actually looking after them, because it is infectious from one person to another. Why is there so much panic? The lack of verified facts and floating rumors are to be blamed for this panic. People are taking the information that they've got and they are adding a story and another story and another story. And the best thing is to actually look at what is the verifiable sources, where can we actually get them, how do we work with that, and what is important, not to spread fake news. Please, fake news is the killer of any human psyche. Point number 4 is, will I die if I catch the disease? Categorically no. It is not automated that it is not automatically that you are going to be dying. We have seen in the statistics that the recovery rates are getting better and better, and almost 80% of people have mild symptoms and recover from the disease in 2 weeks. Most of the symptoms can be treated with timely medical care. And timely medical care does not mean that you need to rush to the hospital and infect other people. It means call your doctor and he will assist you with the great guidelines. Who is getting sick and how sick are people getting? Older people are twice as likely to have serious COVID-19 illnesses because their immune system is low, and that is normal. Every person that is of an older age, as well as young children, the immune system are not strong enough to withstand COVID-19, and everything has to be done to make sure that these vulnerable people are actually looked after and to prevent the virus from spreading. Point number 6, how exactly does the coronavirus spread? This has been a contentious systematic process of discovering over the last 3-4 months, since December. So an infected person can spread the infection to a healthy person through nose, mouth, via droplets produced on coughing or sneezing. And close contact with infected persons are actually the biggest spreader, and then contact with contaminated surfaces, objects or items of personal use. This is where we are in a restaurant. We are taking a pen from a waiter that has been handled by 15, 16 to 100 people that evening, as well as on those surfaces, the coronavirus is living longer. So on harder surfaces, the coronavirus has got a longer lifespan. In more porous surfaces, it has got a shorter lifespan. Can it be passed on through food? At the moment, there is no such evidence. So we cannot say that that is happening through the passing of food. Experience with other viruses like SARS and MERS suggests that people do not get infected through food. So if it is an upper system illness, and from this one need to be making sure that you have got protection that you've got. Can I please just ask, John? I think I'm going to mute you. There are people in your office. So point number 7, can it be passed through food? I'm not going to repeat everything in there. No, not yet. It has not been identified that it can do that. Do I have coronavirus if I'm coughing and sneezing? This is a thing that each one of us that is actually have been in contact with other people for the last 14 days or even longer, every time that you are coughing or sneezing, that you're thinking, do I have it or don't I have it? So you can suspect to have coronavirus only if you have symptoms of fever, of coughing, sneezing, shortness of breath, and any out of these is coming back again to your travel history, to the corona affected areas like China, Iran, Italy, Germany, Europe. We can go on there. Close contact with persons in those environments, and visiting a healthcare facility, labs where coronavirus patients are being taken care of. So last night on BBC News, they were interviewing the healthcare system workers, and at the moment I think there's a 12% to 30% infection rate of healthcare workers, of nurses. So this is people that has been directly working with the patients of coronavirus that has that. Point number 9, keep track of what your symptoms are. Coronavirus can get your symptoms like fever, cough, shortness of breath, etc. You can see on the picture on the right hand side what to do there. I will get to that. They will be almost similar to common cold or flu and may appear 2 to 14 days of exposure. The normal period is between 5 to about 7 days. After that, the infestation or catching corona is getting less. Severity of illness can vary in different people, from mild to severe symptoms. And if you have fever, cold, or sore throats, don't panic. Take good care of yourself. And on your right hand side, if you have got a nebulizer, nebulize. If you can steam yourself for 2 to 3 minutes a day, and even more frequently, do that. Stay hydrated and get adequate rest. Make sure that you are drinking water. Water is a cleansing system for our bodies, and rest, you need to have rest. Washing your hands. We will get to that a bit later, but washing your hands frequently is a must. This is how we are contracting and how we are spreading this virus. If you have got these symptoms, please make contact with your doctors and they will guide you through this. Point number 10, cold versus flu versus the coronavirus. There's a very nice table for you to say what is the incubation period. Firstly, what is your symptoms that you've got there for cold and flu and the coronavirus, and how long do these systems last? So if you're looking at a cold, it is between 7 and 12 days. For flu, between 3 and 7 days. For coronavirus, in mild cases, 2 weeks, and severe or critical disease, 3 to 6 weeks. And the major symptoms that you can see there is fever, runny nose, sore throat, cough, body ache, difficult breathing. And when you are observing these, make sure that you are looking after yourself, hydrating, and consult your doctor telephonically. Number 11, should I be tested for coronavirus if I have high fever, cough, and difficulty in breathing? Or can I get a coronavirus test done just for the sake of satisfaction? Coronavirus tests are fairly expensive. And this is why, if you're looking at the pre-screening process, the pre-screening process globally is looking at your temperature. If your temperature is actually an indicator that you have got high fever, etc., and your degrees that your body should be is functioning under 37 degrees. Everything over 37.3 degrees, you should be looking after yourself, making sure that you are hydrated and that you are actually managing if there's any symptoms of that. And you need to make sure that you are actually testing in a preventative manner, and that you don't go into hospitals just because that you are thinking that you've got that. Make sure that you've got it, definitely. Can a person infect can a person be affected with coronavirus recover completely and no more infections? Yes. So this is not, if you get corona, this is not a death sentence. This is really the time for all of us to be looking after ourselves and to make sure that you are part of the 80+% of people who have recovered from the disease without needing special treatment. Can the coronavirus be treated? Absolutely. Although there is no vaccine at the moment, we know that last week Tuesday, the first kind of vaccine has been administered to a person in America, and we are waiting for the results, if that is working or if it is not working at all. So please make sure that if you are getting into the coronavirus space, that you are actually looking after yourself. How long, point number 14, how long does the coronavirus survive on surfaces and on objects? It can survive 8 to 10 hours and longer on various surfaces like paper, untreated wood, cardboard, sponge, and fabric, and a little more than this over non-porous surfaces like glass, plastic, metals, varnish, wood. And please make sure that you are not only washing your hands, that you are also washing the environment that you are in, where people has touched it, and where people are, where the virus can be on a surface. Point number 15. Should the coronavirus outbreak concern you about your pets and other animals? This is a tough one, because there has been rumors that pets have been infected. Confirmation of it is vague. So I think if one is assuming that it can be done, then one must be very mindful of the matter to make sure that every time that you are touching your pets, that you are washing your hands, and because the pet's fur is actually holding on to the droplets that you've got. And a pet is also a surface, so the fur is a surface. Point number 16 are the 3 Ps, all it takes to defeat corona. So these 3 Ps are very important, that all of us are looking at this and make sure that what we are doing, that we are actually constantly having this in mind. Firstly, wash your hands as regularly as you can with soap and water. Keep alcohol-based sanitizer close to you, and if you cannot wash your hands with soap and water, please have an alcohol-based sanitizer to just sanitize your hands. Don't touch your eyes, your mouth, your nose with unclean hands, because this is how you are contracting and how you are moving the virus around. Keep your distance of at least 1 meter to 2 meters from anyone coughing or sneezing. The droplets that is coming out of the respiratory system is actually transmitted through the air and have a floating space of between 1 to 2 meters. So keep that in mind. Follow no-touch greetings and no germs contracted. So the new greetings with the elbows, with the foot, with everything else than by touching is actually the best way, and prefer namaste or hand waving over a handshake. Point number 2 of the 3 Ps, protect your loved ones. Don't sneeze or cough into your hands. Make sure that you are using a tissue and throw it away immediately in a closed bin, or sneeze in the inner side of your elbow. Don't travel or visit crowded places if you're sick, and make sure that if you are not sick and you are traveling to the shops, observe all the rules that has been discussed in this webinar, and do wear a mask if you're sick, and also if you are taking care of someone with the symptoms. You can see I am sitting here with my with my self isolation, and we are making sure that everything that we are doing is actually correct, and that we are working within the limits of the rules. Point number 3, protect your community. If you feel unwell, seek medical attention. Please call a medical doctor. Don't walk into the hospital, and don't go to the offices if it is not needed. If you have a fever, cough, or difficulty breathing, stay indoors. Healthcare, call the healthcare professionals and follow their advice. And do not share just any forwarded messages, because false information, I see that governments are taking action against people that is actually forwarding or creating fake news about this. Where can I get true information? For the people, we will have this every time, updated slides. First and foremost, fear the social disruptor. Fear is actually creating for people the biggest challenge, because it is working on your psyche. So if you're looking at this pandemic, the World Health Organization is actually our leading information provider, as you can see there. The presentation that we've got here has got links that is up to date, so you can get on the World Health Organization, you can get their situation reports, you can get the overview of what they are doing globally. They are actually the go-to place. They've also got a WhatsApp newsroom that you can go and register on it. You can get information from a trusted and a reliable source. The Department of Health in every country are doing their own information distribution. The Disaster Management Act is doing the same. Myths and facts about COVID-19. There's a toolkit that is available. Social distancing guidelines. There's also a toolkit available on this presentation. COVID-19, the 10 steps guide to self-quarantine. There's a toolkit there. And then the self-quarantine guidelines, also a toolkit, and coming into contact with someone diagnosed with COVID-19 guidelines, and the 4 precautions to follow to avoid being infected. This is most important. There's also a toolkit. And I saw that the coronavirus resource portal has been launched yesterday. So go and click on that. And if you want to be up to date with everything that's happening around the world, you can click on this live link, and it will provide you, I hope that you can see this, it provides you with all the facts up to date that you've got access to. And there's your quick facts. It has now risen to 435,394, 19,597 deaths, 12,641 in a serious condition. Recovered is about 25% if you're looking at the 435, and it's now in 184 countries of the 195. And you can see also all the detail with every region that you want to have there. So even there's Africa, so Algeria, everywhere that you can have all the detail in that one there. So this is very important information that one needs to be looking at. Just want to get out of this one quickly. And then if we are looking at the last one, you can also, the last link, I've seen that it is a bit older information, but it is also a fantastic source of information. I would work with this, the second last one. The way forward. Tomorrow we are having 3 sessions on COVID-19, as well as how do you use the various tools that you've got available within systems. how can you analyze this? So we've got a session tomorrow morning, 10 o'clock, a second session at 2 o'clock in the afternoon, and a third session at 5 o'clock in the afternoon. And these webinars will be hosted by Credit Advisory Africa in conjunction with CGE Risk Management Services in the Netherlands. So we will be doing this together, and we will specifically look at how do we actually work with the analysis of the causes and the consequences, whether it is a simple analysis from your employees that is getting sick, or you can have this one that we have built that is actually working with a country analysis to make sure that one is actually looking at every avenue where you can make sure that you are having enough knowledge and that you can work with that. Just want to, sorry, the last one, in the next week, we will also be looking at business continuity and leadership, because leadership in this period of COVID-19 is one of the most important role players to create the conditions and to ensure that the tone at the top are actually looking after the employees and making the work environment safe for everyone. And then also we will be looking at next week in business continuity management and the various strategies. Now we have looked at, this one is very important, because if you're looking at any business disruption such as COVID, you're looking at an 8-step strategy process or a combination of it. And what are you actually using? So we will speak about the strategies, and we will also test each one of them. Are they working? Aren't they working? Because actually we are starting to rewrite business continuity from scratch. Okay, this is the end of my presentation. If anybody has got questions, please feel free to raise it now, or to send us an email, or even on you have got the Zoom app, and you can, on the Zoom app, you can actually give us a better, sorry, I just want to make this bigger, on the Zoom app, that you can ask the questions to us. Are there any questions? Are there any questions that you want to ask about COVID or business continuity? Please type it in for us in the chat box, or use Alt and H, and we will answer your questions. If you don't have, thank you very much, and enjoy the rest of the day. Be safe.